Hi, my name is Remy Shergill. I'm the Campaigns and Communications Officer at the Climate and Health Alliance here in Melbourne, Australia. I'd like to acknowledge that I am recording this video on the lands of the Wurundjeri people of the Kulin Nation. I would like to acknowledge that sovereignty has never been ceded and that this always was and always will be Aboriginal land, and I'd like to pay my respects to their elders, past, present and emerging. I'm here today to talk about CAHA's communication guide aimed at health professionals to help them talk about climate change. The reason we did this guide is we know that climate change is a massive health issue and that effective communication is a really important tool for health professionals in order to have positive health outcomes. This absolutely applies to climate change. It's the biggest health challenge of the century. The guide summarizes a broad evidence base of climate communication, health communication. We think it's a really practical guide with with tips and messages that you can adapt straight away. It looks a little bit at why climate change is considered a health issue, talks a little bit about the movement that's building up within the health sector around climate change, and also why it's well within your remit and your duty of care to do this work. I'm going to go through 8 of our golden rules, and then I'll talk about where you can implement this action. Simple messages repeated often by trusted voices are most effective. You may have heard this mantra from Ed Maybach. The good news is you're already a trusted voice as a health professional. So let's work on the simple messages that we can repeat over and over. Frame climate change as a health problem, because it is. We've probably were all introduced to climate change as through the frame of an environmental catastrophe, but it's also a health problem. It's also, a justice problem and an economic problem, and it's really one of those wicked problems that covers all areas of our lives. The reason that we're going to talk about it as a health problem is obviously you're health experts, and that's your area of expertise. The other thing is it is a universal value. So when it comes to talking to your audience's values, health is something that you can use to connect with almost anyone. And when talking to an audience's values, it's about thinking about what's important to them. So if it's their health, if it's the health of their children, the health of their community, you can talk about what you know that person is interested in to make it relevant to them. Also, to make it relevant and a solutions-focused conversation, you can talk about the health co-benefits of action, whether it's installing a gas-free kitchen or riding your bike rather than driving the car, or eating less meat. There are many health co-benefits of climate action, and even people who don't have any intention of taking climate action can be encouraged to do more of these activities for the health benefits. Extreme weather is a good opportunity to educate people. I'm sure you would have heard a politician say that now is not the right time to talk about climate change after a bushfire or a hurricane or a flood. Wrong. It is the right time. People are paying attention. People want information about why this happened, and it's important that as health professionals we're honest and we talk about the evidence. It's not making it political to talk about climate change after extreme weather. You shouldn't feel afraid of that. You can and should avoid polarizing language like crisis, particularly in a clinical setting. This language works really well for some people. I know I personally think that it is a climate crisis, but it doesn't work well for everyone. It can induce fear or skepticism in some audiences, and this means that they're going to switch off and not absorb your important message. Lastly, the last 2 is about sticking to your area of expertise and feeling confident in your area of expertise, which is, of course, health. If someone wants to debate the science with you, that's not your role. You're not a climate scientist. You're not expected to have absorbed the contents of the IPCC report and be able to answer any question they have. By the same token, if someone brings up what are we going to do with our jobs in fossil fuels? This is not your realm, and you don't have to feel obliged to answer those questions. You can bring the answer back to your area of expertise, which is health. You could say, I know that climate change is affecting health. I see it in my work. I read it in peer-reviewed articles. This is my area of expertise. It is a health problem, and you don't have to justify it any more than that. You don't have to convince people. If you do come across a denialist and that's clear, I recommend aborting the mission. You're probably not going to convince them, and it'll give you a headache. So some of this requires some thinking about how to talk about it, but it's really important because this is your opportunity to tackle climate change and the consequences it's going to have for our health. And as health professionals, you're in a unique situation to really convince a diverse range of audiences of this across the political spectrum. But I want to talk a little bit about where we can do this work. So it's not just, I have mentioned interactions with patients. You know, if someone comes in and they have asthma, it's very reasonable to talk about how wildfires will become more common, or how the burning of oil in cars creates air pollution, which makes it hard for them. Whatever their own health considerations are, you can, if climate change is relevant, you can bring it up in that setting. You can also do it in your waiting room, have some pamphlets, have some information there about how climate change affects health. In your workplace, around the world, healthcare settings are responsible for 4.4% of emissions. In the US, I think it's 10%. In Australia, it's 7%. There's lots that we can do in our own workplaces to make them a more sustainable institution. On your website, talk about why climate change is a health issue on your website. You can approach media, radio, TV, and newspapers, particularly local media, about any effects of climate change you're seeing in your local area. The voice of a health professional talking about that would be really, really interesting for most journalists. To your elected representative, our elected reps don't hear from us as often as we think they do. And the opinion of, a health professional, particularly one that's, embedded in their community, is really valuable and persuasive. Online, if you've got professional platforms that you use, Twitter or LinkedIn, start posting about climate and health. It will influence your colleagues. It shows people, it's socially norms talking about climate change and health. And yeah, by the same tokens to your colleagues, if your workplace isn't well set up to be a sustainable workplace, if you know another colleague who cares, talk to them about it. See if you can find others. Start a green group. Go talk to management about the things you want to see change. Basically do something. Action is really, really important if you care about climate change, because action brings hope, not the other way around, as I learned from Greta Thunberg. Climate change is a health emergency. As a health professional, your voice counts. I believe that every one of us has a really important role to play in this movement, and that health professionals can depoliticize climate change in a way that many people can't. So it's really wonderful to have as many of us playing our role. You can find our guide at caha.org.au/communicate for more tips and tricks and to go into more depth on anything we've talked about. Thank you.